Hello, welcome to the program. I am Nancy Nnaji. So nice to know that you're joining us, Moneyline with Nancy. Nigeria has reported its first case of coronavirus that was done in Lagos. Let's chat a bit about that. But I think the basic thing I must say is that there shouldn't be fear and there shouldn't be panic. We should try as much as possible to prevent ourselves from contracting this infection. Today's show is quite a bit packed, so we'll try as much as possible to use all the time we can to take a look at some of the main issues we want to look at. We will also be looking at investment options. My guests will be joining me in a short while, talking about our Finance Friday segment. My guests will be joining me in a bit. But let's get started on the latest updates on coronavirus. Like I said earlier, Nigeria has confirmed this first coronavirus case. The patient returned from Italy to Lagos. Nigeria is now the 49th country to report the COVID-19 case. Netherlands also reported its first case. The patient traveled to Italy and came back from Italy. The Mongolian president under quarantine. So it seems that coronavirus or COVID-19 is spreading fast to most nations across the world. Now let's quickly take our guests. My guests are joining me. The first guest I'll be taking here is with me at the table. He's Dr. Ifeanyi Nsofo. He's the director of Nigeria Health Watch. He's also the chief executive officer at EPI Afrique. Welcome to the program.
Thank you.
And Mr. Johnson Chukwu is also joining me from Lagos. Skype, is he there so that I can get to see him? Yes, Mr. Chukwu, thank you for joining us. Can you hear me?
Yes, Nancy, thank you for having me.
Can you hear me, Mr. Chukwu?
Yes, I can.
Okay.
Thank you, Nancy, for having me.
Okay. Now, let's get started. We had talked about this coronavirus case, that if it happens in Nigeria, now it has happened. What are your concerns? We were talking just a few days ago. You also came in from Lagos. You were of the view that when you came in at the airports, there was no surveillance, no one to check your temperature and all of that. What are your concerns now?
Well, unfortunately, our warfare has actually been confirmed. I've always wondered why we don't have a candidate case in the country. Now we have one, and my concern has been that the government preparedness doesn't show that we are ready to contain the virus should it come into this country. Unfortunately, it has come in. Now we need to see how ready we are and how quickly we can track and trace all the people contacts that the candidate patient had. I understand he came into the Milan International Airport in Lagos. He came in on 25th and then fell ill on 26th. They've not told us where he reported his illness. They only told us that they have quarantined him somewhere in Yaba. But the key thing we need to find out that how many people did he have contact with? Who are those that sat beside him at the airport in the plane? Who brought him from the airport to his residence? How many people are in his residence? We need to track and trace these people and quarantine them. The concept that people should stay in their homes and quarantine themselves is absurd. I mean, we've seen countries quarantine people in China locked down a city. And we're telling people who are sick to stay at home and call the number. I think that, for me, does not show heightened level of preparedness.
Okay, let me bring in the doctor here, who is also into public health. Dr. Nsofo, what are your views?
Okay, I think first of all, I need to re-echo what you said. This is not the time for fear. This is not the time for panic. This is the time for us to understand the fact that the Nigeria Center for Disease Control has set some mechanisms in place even before this particular case, was identified. And I think that it's very important for us to remember that in Nigeria there are 4 reference labs, managed by the Nigeria Center for Disease Control, that can test, and be able to diagnose the coronavirus. So granted, we have a case now. The case is at the infectious diseases hospital in Yaba, being managed, and part of the protocols that the NCDC and the Ministry of Health are put in place by now is to say, okay, who are the people who were the people you had contact with in the past 2 days that you've been in the country. And they will go to those people and find out if those people are having any signs and symptoms. If they are not, then the correct thing to do, and this is why we should not panic, the correct thing to do is not to quarantine because they don't have any symptoms. The correct thing to do is to tell them what to expect and what to do if they start having, some of those symptoms.
Why did you say we shouldn't quarantine them?
Because they don't have any. They don't have any infection.
But how about countries that quarantine them for the next 2 weeks, for 14 days?
No, so I mean,
They're supposed to quarantine at least for 14 days and see if there are symptoms. If there are no symptoms, you'd let them go. No,
so I think first of all, for people who have signs and symptoms, yes, you can do that. For people who have a travel history, I travel with this person. We were on the same flight. I've come into the country. What are you quarantining me for? And I don't have any signs or symptoms. What you're going to tell me is to self-isolate. That is the standard WHO protocol. Even countries that you're talking about, maybe apart from China, because they went
epicenter.
Yeah, so you tell people, please, go about your business. But if you notice these signs, get back to us, take your temperature and stuff like that. And because let's not forget that if you get people together in one place again, because all in the name of quarantining people, then that even increases their chances of, if any of them, for example, eventually develops signs of the coronavirus. That also increases the chance of people, getting it because you've put them in one place.
I think the Ministry of Health I should say they should be on top of this matter now. But my own concerns are perhaps the stages of how this infection was first reported. Okay. In the sense that, okay, he came into Nigeria, so he reported the case, gone to the hospital, that is the detection, yes. Yeah. Detection, he's been taken to the infectious disease hospital in Yaba. From there, contact tracing. That is where I'm having the problem with right now, in terms of how do we now begin to detect those contacts? Because he flew from Milan, I think, landed in Lagos. Yeah. He would have contacted people, the vehicle he was in, perhaps the people in his house, those that may have shaken his hands, and all of that. How do we... Don't you see that's where the missing link will come from? Yeah,
I think we really need to believe in the capacity of the Nigeria Center for Disease Control to do what they know how to do. Because everything you've just described are the protocols that they've put in place. While I was coming here, the Minister of Health was having another press briefing, with the DG of the Nigeria Center for Disease Control, updating Nigerians about about the case, what they are doing, and stuff like that. And I want us to compare what is happening now with what happened during the Ebola outbreak, in 2014, 2015. You see a vast difference, between the level of preparedness of the country and the leadership of the Nigeria Center for Disease Control.
So are you saying that we're more prepared right now to
Absolutely.
Based on?
So based on, first of all, let's not forget that before we got this case, NCDC was putting out regular information about what people are supposed to do. In fact, last week, part of the WHO, another partner, they developed guidelines for how health workers should manage cases when it comes to them. They've been doing trainings with different communities across Nigeria on how to increase risk communication. In other words, what people should know, what they should do, when they come across some of these things. And the fact that they have a network of laboratories in Nigeria, 4 of them. If you look at across, in fact, there was a map that was shared by WHO about a week ago or 2 weeks ago. That was the first time you see a map of Nigeria that is green, because a map of the Africa with Nigeria being green. Why? Because Nigeria is one of the few countries on the continent where you can test and diagnose for coronavirus. So when you see all these things, I know that usually people will panic. But when you see all these things and look at the leadership of the Nigeria Center for Disease Control, let's trust that they can do what they are supposed to do.
Okay, let me bring in Mr. Chukwu here. Do you trust? Because I think that this is a test for our health security system beyond what doctor is also saying. Do you think so, Mr. Chukwu?
Well, Nancy, all the indices we have will not give anybody that trust. I'm impressed with what the doctor is saying, but I hold contrary opinions to everything I just said. But let me start with the most critical thing for me, the issue of prevention. As they tell you in medical practice, prevention is better than cure. I don't think we're taking appropriate preventive measures. I did mention the issue of quarantining people. He had a contrary opinion, and it's very simple. Countries with more advanced medical standard and more medical equipment and better medical services are quarantining people. In this kind of patient has gone to a convention.
Mr. Chukwu, the network is breaking. I hope we can get you again. But Mr. Chukwu was just saying that perhaps, you know, he's disagreeing with you on some in some areas.
No, yeah, I mean, he's right. You know, he has his right to disagree with what I say. But for me, I'm talking purely from the public health, you know, side of things, not what I think personally, or you know, or giving into the panic and fear that exists. I know we have challenges with our level of epidemic preparedness. You know, we have a project in Nigeria Health World called the Prevent Epidemics Nigeria. We point out some of the deficiencies, but once it comes to this coronavirus, I can assure you the level of preparedness of the Nigeria Center for Disease Control.
Where do you think the missing link is? Because even from what you're saying, it's as if we should all go home to sleep.
No, we shouldn't. Because part of what NCDC has also done, even before this case, is to keep putting out info. So first of all, if you look at what should Nigerians do to prevent coronavirus? They're very simple hygiene, sanitation practices, which we should be doing normally, not because we have, you know, we have a case of coronavirus. I know in all this, because this is where I think Nigerians can also be selective in what they are concerned about. Before this case of coronavirus was identified, NCDC is dealing with the largest Lassa fever outbreak in the country. 600 cases across, you know, several states in the country. About 157 people, you know, being were confirmed dead and all. So why are Nigerians not bothered about Lassa fever, for example, but people, you know, are much more afraid of coronavirus? You get what I mean? Because if you look at it, we also have to appreciate the fact that.
But coronavirus is airborne, and that's a lot more people could be susceptible to it than Lassa fever. Lassa fever is caused by rats, so if you can avoid areas, keep your environment clean and all of that. But for coronavirus, is airborne through droplets. I don't know. You know, when we're greeting, we didn't even shake hands because. Do you understand? So I think that is more infectious, as it were.
No, I think it's
in terms of transmission.
I think we need to also understand the global focus. It's in the news. It's all over the whole place. So everybody, you know, because if you're talking about infectious diseases that are quite infectious, measles is the most infectious disease. In fact, when somebody that has measles sneezes and leaves, minutes after the person leaves, that same space is infectious. But you don't see people, you know, panicking about that. As we're saying this in DRC, you know, about 6,000 people have died of measles, you know, since 2019 when their latest outbreak happened, you know. So,
and also I think in an Asian country too, is it Philippines or one of these countries?
In the Philippines, even in the
Chile
US, you know, measles kind of reared itself, but you don't see people panicking about some of these things. I think that.
Why? Because perhaps there's a control.
Yeah.
Now, there's a vaccine against measles for young people, but this one, coronavirus, is new. Nobody has heard about it. People are still in the lab trying to, you know.
Yeah, but we know that the prevention is simple. Now, we have about 83,000 cases worldwide. But how many times do you hear the fact that about 36,000 of those cases have recovered? You don't really hear that most of the time. You hear about the ones that died. 2,000, you know, 300 and above have died and stuff. And I'm not, you know, kind of, you know, belittling that figure. But I think that managing information in times of outbreak like this is very important. Because people, you know, people really panic, and the panic and the fear, those are the things that will push people to begin to do all sorts of things. I'm sure you've come across the, you know, some of the information on social media and also on internet generally about the Ghanaian pastor who is selling, you know, special anointing oil to prevent coronavirus. Yeah? Yes. You know, there's also an American evangelist that, you know, was, you know, on TV talking about a particular concussion for prevention of coronavirus. So because it's all over the whole place, and before you know it, misinformation will come into it. People will panic. Let's just know those simple things that the Nigeria Center.
We'll come to that in a bit as we'll finish this segment. Is Mr. Chukwu still there so that we'll get his last take? Is he still there?
Yes, Nnaji, I'm here. I can hear you.
Yeah, so you've been hearing what I've been speaking about with Doctor. we've been looking at perhaps transmission lines and all of that. What do you have to say?
Well, the key thing is that the transmission, this is a respiratory borne infection. Have you lost me again?
No, I've not. Go ahead, please.
Okay. So the method of transmission is quite easy, and you are talking of people who are coughing or sneezing, and because of the nature of our population, because of our way of interaction, when you meet people, you pump hands, and most likely many Nigerians sneeze into their palms. And you pump hands, and next time you are rubbing your face or your eyes, your nose, and then you get infected, the other person is infected. So we shouldn't belittle the fact that transmission is very easy. The transmission method is actually easier than the Lassa fever that has killed a lot of Nigerians. And that's why some of us are concerned that if we do not keep away those who are possible carriers until we can certify they don't have such infections, that if it enters the lower cadre of the society, it will be difficult for us to control. Remember, a number of people don't go to tertiary hospitals. They go to primary health care centers. They just go to chemists, pharmacy shops to do pain medication. That's the first. And the symptoms are also similar to symptoms of infection that are common here. Fever, sneezing, coughing. These are symptoms that are related to things like malaria. And should people have that, their first point of contact is not going to be the disease control center, and we only have 4 in the country. Granted, 4 is good enough, but their first point of contact will be they go to a pharmacy to go and treat themselves. It's only when it deteriorates that they go to hospital, and many hospitals, private hospitals, may not even have the capacity to determine whether it's coronavirus or not.
Okay.
So there's a likelihood that if people are at the lower cadre of the site are infected, they are going to pass it on to several people. And that's why I'm concerned about how we are tracking and tracing and keeping away those people, isolating them for the meantime until we can determine they are not infected.
Okay, let's talk about Lagos, where you are. What's happening there? Are businesses still going to their businesses? Is there anything the government is doing in terms of perhaps providing hotlines for people to communicate with them if there's any area of concern? And we will still put the emergency lines on air. So I guess my people will be working on that now. If you're in Lagos, the numbers to call. So, Mr. Chukwu, what's happening in Lagos?
Well, thank God for social media. I mean, almost everybody who has a smartphone now knows the numbers to call and the basic things, precautionary measures, because beyond what the government is doing, the people are also doing a lot by circulating information on how to prevent and manage cases of coronavirus. So I hear that the governor made an announcement this morning. The governor of Lagos State, made an announcement this morning. I know the Minister of Health is making an announcement. I know the managing director, the Director General of NCDC is also communicating with people. So in terms of passing information, I think they are doing a lot since yesterday. I mean, they made an announcement around 4 a.m. this morning that we have a candidate case in the country. But the key thing, my concern is that we also need to track them and possibly isolate them from the general public until we can determine. I mean, if the man's cook or driver gets it, he's not going to go to a tertiary hospital. He's going to go to a primary health care or try to do safe medication. So we need to address that. I think that's where the gap is. But in terms of information dissemination, a lot is going on. Use of social media, use of public method media, mass media. That's to a large extent they are doing well. Okay.
I think, Mr. Chukwu, let me come back to Doctor for his final take. Preventive measures, what should we do?
Yeah, so again, we've said that this thing is respiratory. So the basic, first of all, hand washing, and I think we should remind Nigerians again and people watching that hand washing is not washing your hands into a bowl, which is, something that's very common. Hand washing is washing your hands under running water. And it's not necessarily under tap. Somebody can pour water for you, but you have to wash your hands with soap. And of course, the way people sneeze, most people will sneeze into
and it's thorough washing of hands.
It's thorough washing of hands. Not
like
this one. You just do
hand washing for like 20 seconds.
20 seconds, yeah.
With soap and wash it well.
Yeah, like WHO says, just hum, happy birthday under your breath within 20 seconds. But wash the front of your hands, behind the back of your hands, in between your webs, finger webs and all, and of course the tips of the fingers. Then of course how you sneeze, you sneeze either into the the cover of your elbow or your sneeze into tissue and dispose it properly. And I think because the signs, the symptoms of coronavirus are very common. The common ones: fever, cough, shortness of breath. The thing is that if you have some of these symptoms, it's better for you to even self-isolate yourself. But if it gets worse, of course, the next thing you should do is to go to the hospital, not to go to the clinic. Not to go to pharmacies and chemists to get care. So if you look at what we ought to do, they're just the basic sanitation and hygiene practices: how you dispose of sputum, how you wash your hands, how you ensure that your environment is clean. And that's why for us, again, the project I told you about, Prevent Epidemics Niger, what we say is that there must be an epidemic. Epidemics will happen. It's not a question of it's not our portion. It will happen. And because of that, we need to develop a lifestyle of cleanliness, of hygiene. About last week, I went to Utako Market, and you need to see the refuse, the amount of refuse all around the market.
And there's a government.
And there's a government, in FCT.
That also collects money and co from everybody.
Yeah, but people were not perturbed.
And rats will be going there.
In fact, just when I came back to enter my car, just right by my car, I saw a massive rat dead right there. But you see that we're not perturbed about some of these things, because it is only when these things become a lifestyle, a culture, the way people, we observe, lots of, hygiene practices, whether as individuals, in the community, but also most importantly, even in the facilities. Because there are few facilities where you walk into and you see that the hospitals have tap for doctors and health workers to wash their hands, and stuff like this. So that's the thing. But to me, absolutely, we need to look at this coronavirus that we reported in Nigeria and follow the right protocols, not what we think as individuals. That's very important.
For me also, my heart goes out to, not just my heart, my support goes out to also the health workers that will be in on the line, working day and night. Since we've reported a case, they will be in the eye of the storm. So we'll pray for their protection too. Not just also pray, there should also be protective measures. That will put that in check. And I also know that some monies are being earmarked for this to check. I hope it will not be like the Ebola days and something like that. But let's hope things are done better this time. Thank you very much, Doctor, for joining me. All right, I've been speaking with Dr. Ifeanyi Nsofo, who is the Director, Nigeria Health Watch, CEO, EpiAfric, as well as Johnson Chukwu, the Chief Executive Officer at Cowry Assets Management. We've been looking at the first case of coronavirus detected in Nigeria. Mr. Chukwu, thank you for joining me today. All right, let's quickly take a break. When we come back, it will be time for us to commence our Finance Friday segment. My two guests will be joining me. Investment options for young investors, for young professionals, perhaps for millennials, if you are within that. Even if you are not a millennial, join the discussion by sending us comments, your questions and opinions on social media. I'll be right back.
to a country.
You feel you have a savings goal, you have an investment goal, we can start. So the first thing I'll tell people is that it is not too late to start.
Some may say it sounds very simple, but it's easier said than done. What is actually how small one can start?
You feel you have a savings goal, you have an investment goal, we can start. So the first thing I'll tell people is that it is not too late to start.
Some may say it sounds very simple, but it's easier said than done. What is actually how small one can start?